Welcome to Clinical Microscopy, High-Yield Questions for MedTech Board Exam Part 3. As an MTOD, how would you determine the positive result of HCG pregnancy test? A. Presence of 2 bands. B. No bands. C. 1 band on the control. Or D. 3 pink bands. Kapag ikaw daw ang MedTech on duty, paano mo malalaman na positive ang isang pregnancy test? The answer here is letter A. Presence of 2 bands. So, kapag may dalawang bands or may dalawang line sa kit, that is positive. Kapag wala namang band or walang line sa kit, that is invalid. Then, if may isang band sa control only or sa control area, that is negative. So, tatandaan, kapag isang band lang, that is negative. Pag dalawang band, positive. Pag no bands at all, that is invalid. Dapat ang control ay mayroong line or mayroong band. Next, what is the term used to a person who undergoes drug testing? A. Client. B. Patient. C. Donor. D. B and C. So, anong tawag sa taong nag-undergo ng drug testing? The answer is donor. Donor ang tawag sa taong subject to drug testing. Next, at what temperature range do proteins associated with multiple myeloma coagulate in urine? A. 60 to 100 degrees Celsius. B. 60 to 80. C. 80 to 90. Or D. 40 to 50. So, anong temperature nagko-coagulate ang protein na associated sa multiple myeloma? So, the protein that associated with multiple myeloma is called Benz-Jones protein. So, the answer here is letter D. 40 to 50 degrees Celsius. Why? So, according to Strassinger, unlike other proteins which coagulate and remain coagulated when exposed to heat, Benz-Jones protein coagulates at temperature between 40 degrees Celsius and 60 degrees Celsius and dissolves when the temperature reaches 100 degrees. So, tatandaan, ang Benz-Jones protein ay nagko-coagulate between 40 degree to 60 degrees Celsius at nagde-dissolve siya sa 100 degree Celsius. According pa sa Strass, therefore, a specimen that appears turbid between 40 degrees Celsius and 60 degrees Celsius and clear at 100 degrees Celsius can be suspected of containing Benz-Jones protein. Tatandaan, 40 to 60 degrees. So, ang choices kanina, mayroon lamang 40 to 50, which is pasok pa rin sa normal range na 40 to 60. So, that's why 40 to 50 or letter D is the correct answer. Tatandaan, kapag multiple myeloma, associated protein is Benz-Jones protein. Next, false positive level of HIAA can be caused by ingestion of A. Brown rice, B. Banana, C. Potato, D. Starch. Kailan nagkakaroon ng false positive ang HIAA? The answer here is letter B. Banana. According to Strass, patients must be given explicit dietary instructions before collecting any sample to be tested for 5-HIAA because serotonin is a major constituent of foods such as bananas, pineapples, and tomatoes. Medications including phenothiazines and acetanilids also interfere with results. Patients should be directed to withhold medication for 72 hours before specimen collection. The 5-hydroxyindole acid is a breakdown product of serotonin which eliminated through the urine. So that's why serotonin, food rich with serotonin is makaka-interfere sa result. So examples ng mga foods are bananas, pineapples, and tomatoes. Remember these three: bananas, pineapples, and tomatoes. Next, what is the reagent used in viewing undigested muscle fibers in stool samples? A. 1% NaOH, B. 10% eosine, C. 6N HCl plus Ehrlich's reagent, or letter D. resorcinol reagent. Anong reagent ang ginagamit para ma-view ang undigested muscle fibers? The answer is letter B. 10% eosine. So according to Strassinger, Slides for muscle fiber detection are prepared by emulsifying a small amount of stool in 10% alcoholic eosine, which enhances the muscle fiber striations. Tatandaan, kapag undigested fibers, mayroon siyang striations both vertically and horizontally. Kapag partially digested fibers naman, ang striations lang niya is only one direction. Kapag digested fibers, walang visible striations. So remember, only undigested fibers are counted, and the presence of more than 10 is reported as increased. So tatandaan, 10% eosine or 10% alcoholic eosine is used dito sa viewing undigested muscle fibers. Next, what is the color of positive leukocyte esterase on reagent strip? A. Green, B. Red, C. Brown, or D. Purple? Anong color ang magpapositive sa LE sa reagent strip? The answer is letter D. Purple. Tatandaan, ang leukocyte esterase should be read after 2 minutes. Siya ang pinakamatagal na i-read compare sa ibang sa iba tulad ng glucose or protein. So LE or leukocyte esterase should be read after 2 minutes. Next, which protein secreted by the kidney cells can be seen microscopically in renal disease? Anong protein ang secreted by the kidney cells that can be seen microscopically in renal disease? A. Tam-Horsfall protein, B. Benz-Jones protein, C. Globulin, or D. None. So this question is, medyo nakakalito ang question na ito. But the answer here is letter C. Tam-Horsfall protein. Kasi siya lang yung secreted by the kidney. Ang Tam-Horsfall protein. Because Benz-Jones protein produce sa plasma. So, kapag sinabi natin Tam-Horsfall protein, it can be seen also in renal disease. So the correct answer is letter A. Next, what change in urine is an indicator of pre-eclampsia? A. Increased level of glucose, B. Albuminuria, C. Hematuria, or D. Bilirubinuria. The answer kapag sinabi natin pre-eclampsia, that is albuminuria, letter B. Next, which is an abnormal constituent of feces? A. RBC, B. Bacteria, C. Electrolytes, or letter D. Water. So ano dito ang hindi normal na constituent ng feces? The answer here is letter A. So the normal fecal specimen contains bacteria, cellulose, undigested foodstuffs, GI secretions, bile pigments, cells from intestinal walls, remember, electrolytes, and water. So normal ang electrolytes, water, and bacteria sa feces or the normal fecal specimen. Walang RBC. Tatandaan, walang RBC sa normal fecal specimen. Next, what is the normal amount of lymphocytes in percent of the cell population in BAL or the bronchoalveolar lavage? A. 10 to 25, B. 1 to 15, C. 70 to 80, or D. 100 to 200%. The answer here is letter B. 1 to 15%. According to Strauss, lymphocytes normally constituting 1 to 15% of the cell population are increased in interstitial lung disease, drug reactions, pulmonary lymphoma, and non-bacterial infection. So tatandaan mo na ang normal lymphocytes sa BAL or bronchoalveolar lavage is only 1 to 15%. Kapag increased, probably it is may interstitial lung disease or drug reactions, pulmonary lymphoma, or non-bacterial infections. If greater than 25, that suggests a granulomatous lung disease, and 50% greater suggests hypersensitivity, pneumonitis, or non-specific interstitial pneumonia. So thank you so much. Thank you for listening, RMT.